Hello and welcome. My name is Dr. Himanshu Dhawan. Today, I want to talk you about a successful patient's recovery story. A journey that not only transformed his fertility reports but also gave him something even more important, his self-esteem and confidence back. When he first came to us, his report showed azoospermia, that is zero sperm count. But with the right guidance, support and right treatment, our patients went from zero sperm count to 50 million sperm count within just 2 months. Now you might ask, how is that even possible? But before I say more, check out the reports before and after. 0 to 50 million within 2 months, but not by luck, not by shortcuts. It happens with the right understanding, the right treatment and the right mindset. What usually happens is when sperm count becomes low and the doctors keep telling you again and again, go for IVF or use a donor. Hearing such things repeatedly breaks down our self-esteem and self-confidence. Let's begin by the understanding what really causes zero sperm count and why do so many treatments fail even after years of medications. Zero sperm count can be caused by two broad categories, obstructive and non-obstructive azoospermia. In obstructive cases, the body is producing sperm, but there's a physical blockage somewhere along the reproductive tract. This could be due to past infection, surgery or trauma, or even congenital conditions like the absence of the vas deferens. This means the testes are working fine, but sperms can't come out. In non-obstructive cases, the problem lies deeper in the testicles, ability to produce sperm at all, which can be genetic as well. But there's one more way to look at azoospermia, and this is very important for patients to understand. Azoospermia can also be divided into primary and secondary. Primary azoospermia means the man has never had a sperm production, often due to the congenital or irreversible testicular failure, such as Klinefelter syndrome or testicular dysgenesis. In these cases, even advanced interventions may have the limited outcome. Secondary azoospermia, however, means that man previously had a normal or at least some sperm production, but over the time, due to lifestyle changes, infections, hormonal disruptions, medication side effects, or systematic health issues, the sperm count has dropped to zero. And this distinction is crucial because secondary azoospermia has a significantly higher chance of recovery. Why? Because the body had a capability to produce sperm before, and in many cases we can restore that capacity by correcting the root problem. So just because your report says zero sperm today doesn't mean it's a permanent. Because the body had the ability to produce sperm earlier, we know it can do it again. We just need to identify what went wrong and correct it. Let's understand why this happened in the first place. Sperm production is not a simple switch. It's a complex process controlled by signals from your brain. The brain sends signals like little messengers, mainly two hormones, FSH and LH. Hey, start making sperm. They tell you testicles, hey, start making sperm. If the brain doesn't send the right signals or if the testicles can't respond properly, then sperm production doesn't happen the way it should. And that is how sperm count becomes zero. Now, this breakdown is communication can happen due to many reasons. Hormonal imbalances, your FSH or LH levels might be too low or too high. Chronic inflammation, especially around the testicles or a reproductive organ. Lifestyle stress, high stress, improper sleep, smoking, alcohol, junk food, all play a role. Thyroid problem or insulin resistance, yes, even these affect male fertility. And here's the most overlooked factor, gut health. If your gut isn't healthy, if the gut is weak, inflamed or compromised due to issues like IBS, colitis, bloating, acidity or chronic constipation, then even the best diet, supplements and the medicine won't help because the body's ability to absorb and utilize nutrients become impaired. It's like pouring water into a leaking bucket. In such cases, we are not just dealing with infertility, we are dealing with malabsorption, low grade inflammation, oxidative stress, and a damaged hormone environment. These factors not only affect sperm production but also reduce sperm quality, like motility and morphology. Our patients went from 0 to 50 million in 2 months. Now, that doesn't mean it happens for everyone. It varies from patient to patient. Some may reach 50 million in 2 months, some may take 6 months just to reach 10 million, and especially in cases of secondary azoospermia, when the root cause is corrected, whether it's a stress, infection, lifestyle, or a hormone related, we often see natural recovery even faster, and many men even go on to become father without IVF or a donor. So if your report says zero sperm count, I want you to pause and reflect. Redirect your inner energy towards whichever treatment you are taking, whether it's Ayurveda, homeopathy, or anything. But go in with a full faith. That's a yes, this treatment will work for me. If you carry this belief, then any treatment will show results. So keep your hope alive, ask the right question, treat the root cause, and hopefully you will also see results soon. I hope you have liked this video. Thank you for watching and take care.